Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How long does Percocet stay in your system? Percocet is a combination of acetaminophen and immediate-release oxycodone taken as a tablet for pain. In general, oxycodone, an opioid, stays in the urine for 4 days, saliva for 2 days, and hair for up to 90 days. It can take about 1 day to get a dose of Percocet out of your bloodstream, but it still may be detectable on a drug test. The amount of time Percocet stays in your system can vary based on age, weight, kidney or liver function, your dose, drug interactions or other factors. Percocet contains 2 medicines, acetaminophen and immediate-release oxycodone. Acetaminophen is the active ingredient in Tylenol, and oxycodone is a strong prescription opioid pain medicine. Oxycodone is the opioid that is found in Percocet and may be part of your test. If your doctor has prescribed Percocet for you and you have a medical reason to use this medicine for pain, tell the personnel at the drug testing site before you submit your test. Do not suddenly stop taking Percocet without speaking to your doctor, as you may experience serious withdrawal symptoms. Contact your doctor who may recommend that you slowly stop treatment over a period of time. Learn more. How long does opioid withdrawal last? Do all drug tests look for Percocet? If you are undergoing a urine drug screen, oxycodone may be one of the drugs you are tested for, but it is not a routine component of all urine drug tests. Oxycodone is required in the urine drug tests requested by the U.S. Department of Transportation, DOT, and the U.S. Department of Defense prior to employment. Oxycodone may also be tested for in other sample types, such as blood, saliva, sweat, hair. Urine is the most common type of sample used for drug testing. Many drugs can be detected in hair samples for up to 90 days or longer. Related, Drug Testing FAQs. What is the half-life of Percocet? The rate at which a drug is eliminated from your body is related to its half-life. Immediate-release oxycodone has an average half-life of around 3.2 hours, therefore, most people should fully clear a dose out of their bloodstream within 1 day, but this can vary. Acetaminophen has a half-life of around 1.253 hours, therefore, 1 dose of acetaminophen should also be out of your bloodstream within 1 day or less. The half-life of a drug is the time it takes for the blood concentration of a drug to be reduced by 1/2 of its original value. It takes about 5 half-lives for a drug to be almost fully eliminated from your body, but it still may be detectable on a drug test. The half-life and elimination of a drug can vary from person to person based on age, weight, genetics, kidney or liver function, drug interactions, and even their medical conditions. If you have used Percocet regularly or at high doses, it may stay in your system for longer than usual. Related questions: Vicodin versus Percocet, what's the difference? Can you take tramadol with acetaminophen, ibuprofen, or aspirin? What's the best sore throat medicine to use? What is Percocet used for? Percocet is used for the management of pain severe enough to require an opioid analgesic and for which other treatments, for example, acetaminophen alone, NSAIDs like ibuprofen, or non-drug therapies like ice, heat or physical therapy, are inadequate. Percocet is an oral prescription pain medicine that contains acetaminophen, the active ingredient in Tylenol, and oxycodone. Acetaminophen is a common over-the-counter, OTC, pain and fever reducer, while oxycodone is a more potent prescription opioid painkiller. Acetaminophen can help increase the pain-relieving effects of oxycodone. Oxycodone is classified as a Schedule II controlled substance by the DEA because it has the potential for abuse and addiction. For workplace drug testing, it is typically the opioid, oxycodone, that is being evaluated. How long does Percocet stay in your urine? General guidelines are available for detection times but can vary between individuals. Percocet may be found in your urine for up to 4 days. Many variables may affect the amount of time that a drug remains detectable in the urine or other biological samples, including a drug's half-life, if the person is dehydrated, the drug dose, the length or frequency of drug use, the route of administration, for example, for oral, nasal, possible drug interactions, which may affect metabolism or elimination, cutoff concentration used by the testing lab to detect the drug. How long does it take for Percocet to work? How long does Percocet last? In general, the pain-relieving effects of one tablet of Percocet, 5 mg immediate-release oxycodone, 325 mg acetaminophen, starts to work in 20 to 30 minutes, reaches a peak effect in 1 to 2 hours and generally lasts for 4 to 6 hours. The amount of Percocet needed for pain relief can vary widely among people. In general, your healthcare provider will start you on a low dose and slowly increase it until your pain is under control. Bottom line. The pain-relieving effects may subside in 4 to 6 hours after you take Percocet, but the drug can stay in your system longer. Percocet may be detected in a urine drug test for up to 4 days, 2 days in saliva and for up to 90 days in a hair sample. Testing centers may use different cutoff points for detection of oxycodone. Do not abruptly stop taking Percocet, as you may have serious withdrawal side effects. Ask your doctor how to stop taking Percocet. General guidelines are available for detection times but can vary between individuals based on factors like age, weight, drug interactions, length of use, drug dose, or other medical conditions. This is not all the information you need to know about Percocet, Acetaminophen and immediate-release oxycodone, for safe and effective use and does not take the place of your doctor's directions. Review their full product information and discuss this information and any questions you have with your doctor or other healthcare provider. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.